Afternoon, everybody. Monday marked the launch of our annual Taking Action for Your Health campaign. And over the next 5 weeks, you'll see special reports by Linda Hurtado. We'll host phone banks and web chats where you can connect directly with the experts. And on Wednesdays, experts will be joining us for Positively Tampa Bay this week. The focus is on lung cancer. And joining us with more is Dr. Wade Weaver, an oncologist with Florida Cancer Specialist. Thank you so much for coming in.
My pleasure. Thanks for having me.
Many of our viewers will be surprised when we say that lung cancer is the #1 cancer killer in the U.S. So many folks think of breast cancer, prostate cancer, other things. Why is it so deadly?
Well, I think certainly some other cancers get a bit more publicity, but you're right, the statistics bear out that lung cancer is the most common cancer killer. The reason lung cancer is so lethal, it seems to be very advanced by the time it's diagnosed. Early stages of lung cancer rarely generate much in the way of symptoms, and so patients don't become aware of the disease until it's in a very advanced stage, which limits the prognosis and treatment options at that point.
We created a graphic just to really bring this point home, and according to the American Lung Association, lung cancer kills more people in the U.S. than breast cancer, colon cancer, pancreas, prostate cancers combined. It says that an estimated 160,000 patients die of lung cancer every year. And here's a very common misconception that it only affects smokers. Dr. Weaver, you were saying earlier that there is a significant portion of the population that's also at risk. You don't have to be a current smoker.
Right, so the majority of patients diagnosed with lung cancer certainly have a smoking history, or at least an exposure to smoking, but there certainly are a subset of patients who develop lung cancer without that history. I think that's still our biggest target for preventing lung cancer, is trying to address the cigarette smoking issue, but it's certainly something that patients who have no cigarette smoking exposure can develop.
When you talk about a CAT scan versus a chest x-ray, what are the differences, and when are we most likely to see lung cancer in its early stages?
So chest x-ray, very inexpensive, readily available, but it's like an old black and white television. The CAT scan, a bit more expensive, not quite as readily available, but it's a high definition, widescreen color picture, so you get a lot more detail. You know, lung cancer really only picked up in its early stages when there is some sort of imaging study done for another reason. Maybe a patient's going to have a surgery and gets a routine preoperative chest x-ray, or maybe they are in an automobile accident or some other injury that generates an x-ray of the chest or a scan of the chest, and it's picked up incidentally. And so, again, because lung cancer doesn't cause a lot of symptoms early on, it's only when you find it incidentally that it can be detected at its very early stages.
What can families do to protect their loved ones? I mean, what are the symptoms, if any, that they might be able to look out for? It almost seems like it's a no-win situation.
Right. Well, as the old adage goes, an ounce of prevention and a pound of cure. So smoking cessation if you're a current smoker, or continuing not to be a smoker if you're not, those are the biggest preventative things we can do. Symptoms that patients may present with: cough, particularly if they're coughing up blood, weight loss, and sometimes pain. But again, typically when we develop these symptoms, it's a more advanced stage of disease.
Thank you so much, Dr. Weaver. It's so nice to talk to you.
My pleasure.
Thanks for coming in. If you would like to learn more about Dr. Weaver, the specialist at Florida Cancer Specialist, please visit them online at flcancer.com. And tonight at 5 o'clock, Linda Hurtado will have a special report on the myths about smoking. Thanks for watching, everybody.